Everything we do is geared toward bringing the autonomic nervous system into balance. Now, without wishing to get too technical, I'll give the 1-minute version of the autonomic nervous system. The autonomic nervous system was named by Langley in 1898, and autonomic is just a play on the word automatic. And basically, this is the unconscious nervous system that controls all physiological processes like respiration, cardiovascular function, digestion, endocrine function, immune function, that doesn't require conscious input. And it's divided into two branches, the sympathetic and the parasympathetic, and the details aren't important. But we believe that disease occurs when the autonomic nervous system is out of balance. After all, that controls all physiological and biochemical processes in the body. It's the ultimate regulator of metabolism in the body. And when that's out of balance, you end up with serious problems. Now, it's not just, again, our idea. Francis Pottinger Sr. wrote a brilliant book, 1944. We discussed the autonomic nervous system and its basis in balance as the basis of human disease. And Ernst Gellhorn, who was a professor at the University of Minnesota, had published 400 papers and 8 textbooks on the autonomic imbalance as the basis of disease. And what we're trying to do with diet and supplements is bring an out-of-balance autonomic system into balance. For example, if a patient comes in with a strong sympathetic nervous system, they need to be on a plant-based diet, and they need to be on certain supplements like beta-carotene, the B vitamins, thiamine, riboflavin, niacin, pyridoxine, and folic acid. They don't do well with B12, choline, inositol, PABA, pantothenic acid. They do well with high doses of C. They do well with high doses of D. They do not do well with high doses of E. They do terribly with calcium, but great with magnesium. Forget the 2-to-1 calcium to magnesium ratio. With our sympathetic dominant patients, where we're trying to tone down their strong sympathetic system, we'll put them on 1,000, 1,200 milligrams of magnesium, maybe 150 milligrams of calcium. It's like an 8-to-1 ratio of magnesium to calcium. They do well with certain trace minerals, manganese, chromium, but not zinc and selenium. They do well with the plant-based essential fats from flaxseed or other nut and seed oils like flaxseed, hemp oil. They do well with those. They don't do well with fish oil. Other patients coming to us have a strong parasympathetic nervous system and a weak sympathetic system, and these are the patients that will thrive on a meat diet. These are the kind of patients that would go to Atkins and thrive. They need lots of fatty red meat. They really do well with it. That helps bring the strong parasympathetic system down a bit and builds up their weak sympathetic system. Fatty red meat has certain nutrients in it that have a very strong effect on the autonomic nervous system. For example, fatty meat is loaded with sulfates and phosphates that in the body are converted into free acid. And what that does is it tones down the sympathetic system. Also, fatty meat has lots of phenylalanine and tyrosine, which are the precursors to the sympathetic neurotransmitters norepinephrine and epinephrine. So when you give somebody red meat, you're turning on their sympathetic system, you're turning down the parasympathetic system. Fatty meat has lots of saturated fat, which was demonized for the last 50 years. Fortunately, that's starting to change. Whatever saturated fat may do, it's a strong sympathetic stimulant. So someone who has a strong parasympathetic system, weak sympathetic system, you're trying to bring it into balance, red meat with lots of saturated fat is absolutely perfect for them. Those patients do well with a whole other set of nutrients. They don't do well with thiamine, riboflavin, niacin, pyridoxine, folic acid, but do well with B12, pantothenic acid, choline, inositol, PABA. They don't do well with high doses of C. These are the people that take high doses of C and feel sick. They don't do well with high doses of D. Sorry, Dr. Cannell, who thinks everyone should be on high doses of D. They don't, but they thrive on E. They thrive on calcium. Our strong parasympathetic dominants, who often get the blood-borne tumors like leukemia, lymphoma, myeloma, and sarcomas, which are connective tissue tumors, they'll do well with 2,500 milligrams of calcium and maybe 100 milligrams of magnesium. They do terribly with magnesium. Magnesium makes them depressed, and they read all this literature about the value of magnesium, go on, and they go into depression for 3 days and can't figure out why. They think that they're morally weak because they can't tolerate magnesium, but it's just their innate metabolism. They need huge amounts of calcium, 10, 15 times as much calcium as magnesium. They don't do well with manganese and chromium, but do well with zinc and selenium. They do really well with the polyunsaturated fats from fish oil. These are the patients that actually can tolerate fish oil. Don't do as well with flaxseed oil, hemp oil, chia seeds. They don't do as well with those fatty acid sources. They need the animal-based, not the plant-based sources of essential fatty acids. And they'll thrive on a completely different diet and a completely different set of supplements than what we call our sympathetic dominant patient. Then we have balanced people who have a equally strong sympathetic and parasympathetic system, but they may be functioning at an inefficient level. They're both genetically determined to be equally strong, but they're not working too efficiently. And they need all kinds of vitamins. First, in terms of diet, they do well with plant foods. These are the people that do well on a Mediterranean diet. Fruits, vegetables, nuts, seeds. Yeah, they tolerate grains fine. Fish, poultry, some red meat, cheese. These balanced people do well with dairy products like, of course, raw milk, whole milk, cheese. They do well with a variety of vitamins and minerals, beta-carotene, vitamin A, all the different B vitamins. moderate doses of C, moderate doses of E, moderate doses of E, all the fat-soluble vitamins, moderate doses of K. They do well with moderate doses of calcium, magnesium, potassium, manganese, chromium, zinc, and selenium. And do well with both plant-based sources of essential fats as well as the fish-based and animal-based sources of essential fats. So they need a variety of nutrients at moderate doses. So every diet and every supplement program has to be really carefully thought out, because every food, every amino acid, fatty acid, every component of food, things like the sulfates, phosphates, the vitamins, minerals, trace elements, whatever else they may do as antioxidants, they all have a very profound effect on the autonomic nervous system. And if you discount that or don't consider that, you can end up creating metabolic chaos in your patients. And what we do is precisely design our diets and supplements after determining the level of autonomic imbalance in our patients, using the diet and supplements to bring the autonomic system into balance. And that's when magic occurs in the patients.